Hello everyone, welcome back to my Dentistry Tuesdays, and today is the second part of the fluoridation topic that I wish to discuss with you. My name is Greg Chong, and I've been practicing general dentistry for the last 25 years, and I loved it and I'm happy to share. Now let's get into it. Last week I was responding to a YouTuber by the name of Adam, and he asked a lot of questions, and this is the second part of it, and as promised, I wish to get into the discussion about RFK Jr.'s policies moving forward. He has just been confirmed as the department chair of the Department of Public Health. And in doing so, one of his policies, or what he wants to move forward in, is to get rid of fluoridation in the water system. As promised, I'll discuss about his policies a little bit later in this video. One of Adam's questions is, if we did get rid of fluoridation in the water system, how long will it take, or how soon, or what damage will it occur? I don't have a timeline. I anticipate that I will see more cavities creeping into patients' mouths over time. Currently, what I do see is that most of my patients that actually come in, which is a great thing, that they don't have many problems, and I don't find many cavities. It could mean a couple things, that they're actually able to clean their teeth very well, or maybe they actually don't drink much tap water which has the fluoride in it, and we are heavily relying on fluoridated toothpaste to help them. I do have a select amount of patients that actually do not use fluoridated toothpaste for one reason or another. Because I believe in fluoridation in the tooth structure and preventing cavities, I think it's going to be a shame if they do get rid of the fluoridated water in the water system. I think problems will start to creep back in. And if these problems arise or these issues arise, then I'm here to help. Unfortunately, I don't want to help in this way, but I believe more and more in preventative measures, and fluoridation is part of that. But if they get rid of it for whatever reason and policies, then I may see more business, which is what I don't necessarily wish on someone. I want something very simple, preventative, minimal effort, and that's the care I wish to provide. Now on to the RFK Jr. part. As promised, I wish to discuss with him. He just became the department chair of the Department of Public Health, and one of his policies moving forward that's involved in my dentistry world is he wants to eliminate fluoridation from the water systems. And overall, I believe that there's probably not enough research out there to determine whether fluoridation or too much fluoride can cause some of these health issues like arthritis or decreased IQ or bone cancer. However, with that said, I do believe that medicine has advanced enough that we can now detect things more and more than we did before, and then we're able to put two and two together to see why these bone cancers are being caused by some compound, or maybe it is caused by fluoride. But I think the research is out. I don't think we have any firm conclusions regarding that. He is thinking that the fluoridation causes a number of diseases. One is loss of IQ, which is intelligence, bone cancer, and arthritis, amongst other health issues. In searching through Google, I was trying to look to see if someone reported somewhere the article that he may be basing his information from, but I could not find anything. So if they stop adding fluoride to the water systems, I think we'll be relying heavily on fluoridated toothpaste. And maybe that's what we're doing so far, because a lot of people drink bottled water. I said in my previous video that filtered water from your fridge, what have you, Brita filters say they do not filter out the fluoride on it. It's probably too small to filter out. And then I have some patients who don't use fluoridated toothpaste, and I'm kind of doing an experiment with them where I'm waiting to see if they start to develop cavities more so, or at every appointment that I see them. And I'm gonna see if that's gonna be true. Then it will give me a clue to see what happens when fluoridation may be no longer being added to your local water area. Every day I'm fighting what you guys can eat and drink, whether it's good or bad, that can potentially cause harm to your teeth. I'm trying to be preventative, so I don't have to drill and fill your teeth. I mean, I don't want to have to put you through that or any further more complicated procedures that, of course, are more expensive. Another great question Adam asks is that, what did our ancestors do? Well, if I go all the way back to the caveman, I have a kind of a saying when I say to my patients that caveman didn't have these problems. It wasn't until refined sugar came into the diet of man, and he may not have lived long enough to figure it out that he gets decay back in the day. So when sugar came around, that's when we started to see a lot of these problems because sugar is a primary source of food for bacteria to proliferate and then leach acid onto our teeth to cause holes or decay. And one of Adam's final questions he asked is there a one-size-fits-all apply to this? I would say probably no, because when we do prescribe fluoride to the population, it's based on age and what other concentration of fluoride is actually in their water system, whether it's 0 or just a minute amount. We tailor the dosage based on age and that dose. And so basically, I don't think one size fits all. Unfortunately, that's what the water system is. We are actually fluoridating roughly 1 part per million, and that's blanketing the population, whether you're a child or you're adult. So that may be an issue that is what RFK Jr. is talking about, that maybe the young people who are getting too much fluoride is then linked to lower IQ levels with the developing brain. Again, I believe the research is out. I think if more research is being done, then we can maybe try to figure these things out more so. In the end, I've seen plenty of examples in my practice where fluoridation does help and prevent tooth decay. It is one of these things where we may not fully understand the benefits and risks. And there are so many factors that lead to tooth decay that we can't just place it on just fluoride or the lack of fluoride. And then don't get me started on how they've cut a lot of research funding to the universities that are involved in all these health research and others that will make it much more difficult to move forward as a society and advance as a society. So in conclusion, I want to thank Adam for all these wonderful questions and helping me create this topic over 2 sessions. It's been really, really fun. If you have any questions more about this topic, leave me a comment. If you have another topic you wish me to discuss, leave me a comment as well, and I'll be happy to do so. Have a great day, everyone, and welcome to my Dentistry Tuesdays.